Welcome to Leveling Up Focus, using video games to treat ADHD. To learn more, press play. Please choose a level. Level 1. What is ADHD?
ADHD stands for Attention Deficit Hyperactivity Disorder and is one of the most common mental disorders affecting children. While it is normal for children to have difficulty focusing and behaving, children with ADHD do not grow out of these behaviors. There are 3 types of ADHD: inattentive, hyperactive impulsive, and combined. The inattentive subtype specifically refers to challenges with staying on task, focusing, and organization, and having a short attention span. While there is no single test used to diagnose ADHD, healthcare professionals use guidelines in the American Psychiatric Association's Diagnostic and Statistical Manual, 5th edition, which is also known as the DSM-5, to help with diagnosis. The DSM-5 criteria for ADHD include inattention for at least 6 months, hyperactivity and impulsivity for at least 6 months, evidence that the symptoms interfere with social activities, school engagement, or work functioning. The 2 most common types of treatment for ADHD include behavior therapy and medication.
Level complete. Next level. Level 2. What is EndeavorRx?
EndeavorRx, also known as AKL-T01 in its clinical studies, is an FDA-approved, interactive, engaging, and captivating video game used as treatment primarily for inattentive or combined ADHD for kids ages 8 to 17. It has been developed by neuroscientists and expert game designers. The game has various interactive worlds with mystical creatures and lets players create their own universe as well. Players have to solve problems, complete challenges, and overcome obstacles to unlock new characters. Since it is a form of treatment, a prescription for the game needs to be provided by a healthcare professional and sent to EndeavorRx, who then send an email with a payment link. The cost for EndeavorRx is $99 for 30 days. After paying, an activation code is sent to the email address, which allows you to play the game after downloading the app from the App Store. When all of this is done, children may begin their adventure with EndeavorRx. EndeavorRx has shown compelling evidence of improving attention in children with ADHD. It does so by targeting areas of the brain that are involved in attention function, specifically acting the frontoparietal network by using sensory stimuli and motor challenges. Through navigating various courses, overcoming obstacles, and gathering targets, kids are challenged to multitask while avoiding distractions. To promote focus, the game is designed to be difficult and challenging, so parents should encourage their kids while they play. A prescription requires children to play EndeavorRx for 25 minutes a day, 5 days a week for at least 30 days, and should be used in combination with other treatments. The children's performance is also measured by an algorithm which customizes each patient's treatments. Parents are also able to follow along with the treatment and track progress through another app called EndeavorRx Insight.
Level complete. Next level. Level 3. Success rate of EndeavorRx.
Before EndeavorRx received FDA approval, there were a number of clinical trials that had to occur in order to establish its efficacy. We will only be focusing on the results of 2 studies that occurred to help understand EndeavorRx's success rate. It is important to note that in both studies, participants had to be diagnosed with inattentive or combined ADHD as per the DSM. Participants also ranged between the ages of 8 to 14 and were instructed to play EndeavorRx for 25 minutes a day, 5 days a week for 4 weeks. However, the second trial consisted of 3 rounds of treatment, where each treatment was 4 weeks followed by a 4-week pause for a total of 12 weeks of treatment. In both clinical trials, researchers used clinical assessment tools to compare ADHD symptoms before and after EndeavorRx. In the first clinical trial, researchers found that the group that played EndeavorRx had significantly improved in terms of their attention. Additionally, researchers also measured the participants' reaction time during target stimuli and compared this to base measures. They found that the group given EndeavorRx showed improvements in this area as well. Furthermore, exit surveys indicated that parents of children undergoing the 4-week EndeavorRx treatment reported a nearly 68% enhancement in their children's attention. In addition to these findings, researchers also discovered further benefits of EndeavorRx in comparison to traditional ADHD treatments. Notably, only about 7% of children experienced any adverse events from the treatment, which is a substantial improvement compared to trials of ADHD stimulant medications where adverse events affect almost 40 to 60% of participants. Moreover, all adverse events in the study were reported as mild or moderate, such as frustration or headaches from being on a screen. Finally, the introduction of EndeavorRx helps to reduce any barriers that individuals may have to receiving treatment due to it being digital. Similar to previous results, the second clinical trial also found that EndeavorRx was able to not only improve the ADHD symptoms of children, but also reduce ADHD-related impairments after the initial 4-week treatment period. More importantly, these benefits endured throughout the 4-week treatment pause and were found to be further enhanced by the following 4-week treatment phase. Additionally, most parents and 73% of children in the trial reported a self-perceived enhancement in their ability to focus.
Level complete. Final level. Level 4. Limitations and concerns of EndeavorRx.
For children with ADHD, EndeavorRx has shown fewer side effects that are also of less severity in comparison to other treatment options such as medication. However, it also seems to be less effective than medication when it comes to controlling hyperactivity and inattention, which is why it must be used in combination with some other type of treatment option and cannot replace traditional treatments. Despite the advantages, the game does have some drawbacks. Some potential side effects of EndeavorRx include nausea, headaches, irritability, dizziness, emotional disorders, eye strain, and aggression. These effects were brief in most cases and were reported by less than 5% of users. Moreover, the game is not suitable for people with photosensitive epilepsy, colorblindness, and other forms of physical limitations that prevent them from accessing a digital device for the recommended duration. Additionally, the game requires a prescription to be played and should only be used by the patient.
Level complete. Game finished.